Good morning. Good morning. This is my favorite time of the year. As a teacher, we're always getting ready to go back to school after Labor Day. In this case, our kids now go back to school in the middle of August, but back to school we're going, and it's a perfect time to remember a simple truth. Vaccines save lives. They always have, and they still do. I'd like to acknowledge the commissioners who are with us, Vice Chair of the Health Committee, Anaya, as well as Commissioners Aguilar, Stamps, and McCaskill. We want to acknowledge, of course, our CEO, Dr. Makaitis, and the Head of Public Health, Dr. Joshi, and Joseph Harrington, who's here as a member of the board, right behind me. Good. Cook County Health and Hospital Board. Now, there are others who will be speaking with you today, but I sure wanted to acknowledge our team as we begin. I want to thank everybody for being here and for supporting this important cause. Today, we recognize National Immunization Month, as proclaimed by our Board of Commissioners. This was first introduced by a resolution promoted by Commissioner Miller, and I thank her for recognizing the importance of vaccines. When I was a teacher, and that was 10 years of my early working life, I saw firsthand how vital it was to keep our students healthy so they could learn, grow, and thrive. I also remember the stories of older members of my family, stories of children paralyzed by polio, or families devastated by measles, mumps, and rubella. Thanks to vaccines, those days have become a thing of the past. And I belong to the generation that got all those childhood diseases because we didn't have vaccines. So I know how important it is that we protect our children now that we're able to do that. Because I remember when I was in elementary school, kids getting terribly sick from those kinds of childhood diseases that we can now prevent. But we can't take the progress we've seen for granted. Measles is back. And it's not back because the science has changed, but simply because too many people are unvaccinated. And that puts everyone at risk. One of the early CEOs of our health and hospital system, early in my tenure, Dr. Raju, was always talking about the importance of herd health, that you needed to see that everybody was protected to protect the herd. That's why I'm proud to stand alongside our school leaders, public health experts, and faith leaders united in one message. Let's kick off the school year protected, healthy, and ready to learn. Vaccination is not a political issue. Vaccines are a public health tool grounded in science and proven by decades of success. From eradicating smallpox to eliminating polio, vaccines have saved millions of lives, especially children's lives. It's deeply concerning to see the federal government cut funding for vaccine research, especially at a time when we should be investing more in health care and not less. Our communities deserve policies guided by evidence and compassion, not by fear and misinformation, because that's where we are at this moment, a lot of fear and misinformation. When we choose to vaccinate, we're choosing health, safety, and the community. So thank you for helping to keep our communities safe. Now I'm going to ask each speaker who comes up to introduce the speaker who follows them. And again, Commissioner Anaya will begin, and then Commissioner Aguilar, Stamps, and McCaskill. Thank you.
Good morning, everyone.
Good morning.
My name is Alma Anaya. I'm the Cook County Commissioner of the 7th District, serving the southwest side of the city of Chicago. A lot of communities like Pilsen, Little Village, Back of the Yards, Bryant Park, and many others. I also have the privilege of serving as the Vice Chair of the Health and Hospitals Committee on the Cook County Board of Commissioners, where I continue to advocate for residents to gain greater access to our healthcare system. I want to first off thank the President, also the Department of Public Health, Dr. Yoshi and his team, Dr. Makaitis, and of course, like I mentioned, all of those in the President's office for the invitation to speak today, but most importantly, for the call to action, because that's what we're doing today. We are continuing to encourage vaccination because we do know that it saves lives, especially when we're dealing with young people, kids, children, babies. While measles was declared officially eliminated in the United States in 2000, it is unfortunate that we are in a state where we're having to have this press conference because of the comeback of measles. We know that measles is not just a little rash or a fever. that just goes away in a few days. It can cause serious health complications, and in some cases that we've seen, deaths, especially in children. The best thing that we can do to protect against measles and its effects is vaccination. And they're the right thing to do for our children. We know that these barriers could also exist through vaccination, including some worries about financial coverage or lack of adequate healthcare insurance coverage, or not being able to access the healthcare in the language that they speak. But I'm proud to stand alongside the Department of Public Health and, of course, Cook County Health here in Cook County to reassure people that we are going to make them accessible and that we will try all of our best to make sure that people feel comfortable taking these vaccines. During this season of back to school, I want to encourage also our immigrant community to receive life-saving services so that they can also protect themselves and one another. Thank you. I will make some brief remarks in Spanish. Buenos días, mi nombre es Alma Naya, yo soy comisionada del 7º Distrito del Condado de Cook. Yo represento a las comunidades del suroeste de la ciudad de Chicago. También tengo el honor de servir como vicepresidenta del Comité de Salud y Hospitales aquí en el condado. Quiero agradecer a las personas que están atrás de mí hoy día, al Departamento de Salud Pública, al equipo de aquí de Cook County Health, a la presidenta Tony Preckwinkle, no nomás por la invitación, pero hoy por el llamado que estamos haciendo sobre las vacunas contra el sarampión. Aunque sabemos que el sarampión fue declarado eliminado en los Estados Unidos en el año 2000, lamentablemente estamos en una situación donde está regresando. El sarampión no solo es una pequeña erupción con fiebre, pero causa muchos problemas y complicaciones, especialmente en los niños. Hemos visto que ha habido hasta muertes y históricamente sabemos que el sarampión es algo que daña a la salud de los niños. Lo mejor que podemos hacer contra la protección o protegernos contra el sarampión es vacunarnos. Lamentablemente sabemos que existen muchas barreras que vemos en nuestras comunidades y especialmente en las comunidades de color y los latinos y digo también las comunidades inmigrantes, especialmente los niños que quizás son de bajos ingresos. Sabemos que existen barreras para la vacuna, pero estamos aquí juntos para hacer este llamado de asegurar que las vacunas son algo que se necesitan que hacer y tenemos aquí todo el equipo en el condado de Cook para ayudar con información o con acceso a estas vacunas. De nuevo, queremos urgirle a la comunidad también inmigrante que reciba sus vacunas y que haga todo para poder acceder a esto, para salvar la salud de nuestros niños ahorita que regresan a clase. Muchas gracias por su atención. Now I'd like to welcome Commissioner Frank Aguilar from the 16th District.
Thank you, Commissioner, and my district is in the western suburbs of Cook. I'd like to first thank President Tony Preckwinkle, Dr. Joshi, and Dr. Mikaitis, and the county's Department of Health, Public Health, and all the community organizations and stakeholders who are here today. Back in 2020, my office put a team together to do a quick response to COVID-19. We formed a good force in 16th District made up of mayors, Cook County officials, and community organizers to make sure that the resources and information needed to fight COVID was there. Most importantly, we needed to get the tools in the hands of our residents. I am proud to say that the 16th District, thanks to a great team, that we were the highest vaccination percentage in the entire county. About 72% the district was vaccinated. We must not be compliant. When it comes to measles, vaccination is the most effective and the safe way to fight these diseases. But the fact is that the vaccinations are not enough. There must be a community effort to spread awareness and both be consistent in messaging and constant outreach to reach all our residents and everyone, especially children and those with pre-existing conditions, should be protected from measles. Cook County and our local stakeholders will be aggressive in combating measles. The Cook County's Department of Public Health put together a thought-effective outreach campaign in multiple languages to stop the increase of measles cases and track them down and continue at the highest level of vaccination with the needed coordination of a public safety health measures. Together, we can protect our community from measles and from threatening illness. Ahora en español, soy Frank Aguilar, el comisionado del Distrito 16, que son los suburbios. Y le quiero darle gracias a la presidenta del condado Cook, la presidenta de Tony Preckwinkle, el doctor Joshi, el doctor Mikaitis y el Departamento de Salud del Cook County y todos los que están aquí, organizaciones que están aquí con nosotros presentes. Mi oficina en el 2020, con un equipo muy eficaz, inmediatamente atacamos la amenaza del COVID-19. Con alcaldes del distrito y organizaciones podemos informar a la gente del COVID. Pero más importante, no solamente las vacunas que estén allí, lo importante es que la gente sepa que hay recursos y vacunas para combatir estas enfermedades. Pero no debemos de dormirnos ahora, hay que moverlos rápidamente, informar a todas las personas, especialmente los niños, gente con condiciones, los ancianos, para que se protejan contra el sarampión. El condado de Cook va a tener una campaña agresiva para informar a nuestra comunidad que se vacunen, porque la vacuna es lo más efecto para combatir el virus. Gracias. And I'd like to bring up my colleague on the board, Tara Stamps of the 1st District. Commissioner.
Good morning, everyone. Good morning. Thank you to the board president, Dr. Preckwinkle, Dr. Josie, Dr. Makaitis, our educators, and especially our faith leaders who are here today. Your guidance, support, and care for families in our communities is invaluable. As someone who has taught in the classroom for over 2 decades, I know the truth. Children cannot learn if they are sick. Their health affects their classmates, their teachers, and the entire school community. Vaccinations, especially against measles, are one of the simplest ways to protect our children and to ensure that they can thrive. Measles, once thought eradicated, is making a comeback. In suburban Cook County, over 12,000 school-aged children are unvaccinated, more than double the number from 10 years ago. Measles is highly contagious and can lead to pneumonia, brain swelling, blindness, and even death. That's why this new campaign highlighting vaccinations at ages 1 through 4 or before kindergarten is so important. Faith leaders in our communities have long guided families to make decisions that protect life and community. Vaccinating children is not only medically sound, but it is morally responsible. By protecting our children, we care for our families, our schools, and our communities. We also know that misinformation has caused fear. Let me be clear. Measles are not causing so many of the illnesses that people are alleging. Measles is serious, and vaccination is the most effective way that you can prevent it. Today, I ask every parent, guardian, caregiver to check your child's vaccination status. Talk to trusted health care providers, and use tools like IDPH, Vax Verify, or Cook County Health Express Care to protect your children and protect your community. Together with faith leaders and educators, public health professionals, and families, we can give every child in Cook County a healthy, measles-free school year. Vaccines save lives, so let's make sure that every child is protected. Thank you. And now I'd like to bring up Commissioner Keisha McCaskill.
Good morning. I am Dr. Keisha McCaskill, Cook County Commissioner of the 5th District, serving the southern south side all the way to Chicago Heights. Thank everyone for being here this morning. Thank our health professionals and our President Preckwinkle for the insight and the vision to make this a state of, not a state of emergency, but a state of concern that we need to have all of our children vaccinated. Measles anywhere is a threat everywhere, but the burden borne by underserved communities is especially high. When vaccination rates are low and access to care is limited, outbreaks ripple beyond the individual to families and the entire neighborhood. Families may face medical expenses, transportation barriers, and significant caregiving demands as relatives recover, often with lost wages from missing work and school-aged children unable to attend class. For schools, outbreaks disrupt learning, strain resources, and force swift responses. Classroom closures, contract tracing, and temporary quarantines, ending up with students missing critical instructions and parents juggling caretaking duties. Addressing measles is imperative. In underserved communities, it reduces preventable illnesses, supports healthy families, and keeps students in school, advancing health equity, educational stability, and future opportunity for all. So if we do nothing else as a community and as parents, please have your children vaccinated and vaccinate yourselves. Thank you. And at this time, I would like to bring Dr. Eric Makaitis, Chief Executive Officer, Cook County Health.
Good morning, everyone. Good morning. As you heard, I'm Dr. Eric Makaitis, Chief Executive Officer for Cook County Health, and I want to start with a word of thanks first to our Cook County Health Board of Directors, and especially recognize Director Joe Harrington. Thank you for being here today. Thanks as well to our Cook County commissioners, especially Commissioner Anaya, Commissioner Stamps, Commissioner Aguilar, and Commissioner McCaskill for being here today. And most especially thank you to President Tony Preckwinkle for all of your support and your partnership in this very important topic. As both a physician and a father, I know how important it is to protect our children. Measles is a disease we can prevent with routine vaccination. The measles vaccine is safe and effective and has been used for more than 50 years. We can't forget the illness and tragedy measles caused before the vaccine was developed, including tens of thousands of hospitalizations and hundreds of deaths every year. That suffering's preventable if we all do our part to protect ourselves and our families. At Cook County Health, we believe access to vaccines is a right, not a privilege. We're here to make sure everyone who wants protection can get it. The measles vaccine is recommended at ages 1 and 4, but it's never too late to get vaccinated. 2 doses of the MMR measles vaccine provides 97% protection and lifelong immunity. If you're unsure about your vaccine status or need help getting a shot, we've got you covered. No matter your age, insurance, or immigration status, call our Express Care line at 312-864-1111 to make an appointment or get more information. Again, that's our Express Care line, 312-864-1111. Thank you all again for joining us today, and I am pleased to introduce Dr. Kiran Joshi, Chief Operating Officer of the Cook County Department of Public Health. Thank you, everyone.
Good morning. Good morning. Thank you, Dr. Makaitis, Madam President, and Commissioners. I am so incredibly thankful to be here this morning with all of you, along with such wonderful partners, including educators, community-based organizations, and faith leaders. I want to acknowledge that in this moment, that is really special. Not all public health leaders have such supportive allies. Over the past 50 years, the MMR, or measles, mumps, and rubella vaccine, has saved an estimated 94 million lives. Yet this year, we faced the largest measles outbreak in the last 25 years, threatening our status as having eliminated measles. This is an outbreak that was entirely preventable. Now, we understand that some families may have concerns and questions about vaccines. That's natural. Making health decisions for children is deeply personal, but we must not forget that those choices have a big impact on the health of all our communities. The facts are clear. 97% of people who have measles this year were unvaccinated. We should also be clear about the threat posed by the unchecked spread of measles. It can cause pneumonia, brain damage, blindness, deafness, and even death. It is the most contagious disease we know of, infecting 9 out of 10 unvaccinated people who were exposed. In Cook County, measles vaccination coverage is about 96%. This is enough for community protection right now, but in the past decade, the number of unvaccinated children in suburban Cook County has doubled. If this trend continues, outbreaks will become more likely and more dangerous. Vaccine misinformation is spreading quickly and can cause vaccine hesitancy. If any viewers or listeners have doubts, I urge you to talk to a trusted healthcare provider. Ask every question you have and get reliable science-based answers. Choosing vaccination is about choosing protection for yourself, for your children, and for your community. As a public health leader, as a parent, I share the same goal that we all have, keeping our kids safe. The science is consistent and it is strong. Vaccines work and they save lives. Public health policies around vaccines protect vulnerable populations, prevent school and hospital outbreaks, and keep our communities healthy. Vaccines have been and will continue to be one of the most important tools we have to prevent disease and protect each other. At this time, I'm going to turn it over to my colleague Greg Richmond, the Superintendent of Schools at the Archdiocese of the Chicago Catholic Schools. Thank you.
Thank you. Good morning. Good morning. Thank you, President Preckwinkle and Cook County Health, for organizing this morning's event and for launching this campaign and really working to protect our public health every day of the year. My name is Greg Richmond. I'm the Superintendent of Catholic Schools for the Archdiocese of Chicago. We have about 200 Catholic schools in Chicago, suburban Cook County, and Lake County, with over 60,000 students. The Catholic Church has a long history of supporting vaccination, from Pope Benedict XIV being personally inoculated against smallpox in 1757, through Pope Francis being vaccinated against COVID-19 in 2021. Today, the Archdiocese of Chicago stands with Cook County, urging parents to have their children vaccinated against measles. The Catholic Church permits and encourages parents to vaccinate their children against measles. Vaccination is morally acceptable in a way that parents can care for their family and their community. We urge all parents to have their children vaccinated with a first dose at age 1 and a second dose at age 4 before entering kindergarten. Thank you. It is now my pleasure to introduce Bishop Reginald Sappho.
Thank you. Good morning. Good morning. I'm delighted to be here, certainly. I acknowledge the President, Preckwinkle, and the other elected officials and my colleagues in this great endeavor. I think it's very beneficial when you see the health department and other community leaders working together to assure the public that the efforts to make sure everyone is healthy, that's a good thing. And whenever that can occur, I think that's a good time to acknowledge that. I really am thankful to be a part of this effort. As a religious leader and spiritual leader, I'm obligated to just speak out from a moral perspective about what is happening here. As the chairman of the Proviso Township Minister Alliance Network, I represent that organization today to assure you that getting vaccinated is an important thing. I know that many of you, perhaps parents, are apprehensive about it. There's been a lot of misinformation put out in the community. And as a community communicator, I would like to assure you that there are places where you can ascertain good information. And I would suggest you would contact your physician, as well as go to the website of Cook County Department of Health. .org/measles and get the facts. You want the facts about what's going on and what it takes to make sure that your infants are protected. Remember, children are God's heritage, but He has placed them into the care of the parent. Therefore, as the parent, the decision is yours. We pray that you would not procrastinate, but choose to vaccinate. Thank you. Now I bring to the podium Ali Ortez.
Good morning, everyone. Buenos días a todos. Mi nombre es Elida Ortiz y soy la directora de el Youth Crossroads y soy la directora del Alcance Comunitario, Departamento de Alcance Comunitario. Bueno, estamos aquí, muchísimas gracias, antes que nada, por la invitación de parte del Departamento de Salud de Cook County, que es el condado de Cook, y a todas las personas que están aquí presentes. Hoy estamos hablando sobre un tema bastante importante, que es el sarampión y las vacunas contra el sarampión. Todos sabemos que el año escolar ya está a la vuelta de la esquina y queremos enfatizar la importancia de enviar a sus hijos a las escuelas el primer día completamente protegidos contra el sarampión. Aquí nuestros colegas han estado hablando sobre cuál es la importancia y qué es lo que puede causar eso si no están vacunados. Entre las edades de 1, la primera es la primera dosis que se da y a los 4 se da la otra dosis de esta vacuna. Esto puede causar la protección de un 97% en la comunidad y en la inmunidad de por vida. La otra cosa que queremos enfatizar es que en los suburbios del condado de Cook sabemos que hay aproximadamente 12,000 niños sin vacunar contra el sarampión. Desde 2014 esta cifra se ha duplicado. Y la falta de información sobre la vacuna ha contribuido a la disminución de las tasas de vacuna. ¿Qué quiere decir? Que muchas personas han estado optando por no vacunar, y es lo que estamos tratando de decir hoy, que tenemos que vacunar a nuestros niños al primer año de su vida y también al cuarto año de su vida antes de que entren a las escuelas o a las aulas públicas. Creer en la falta de información conduce a malas decisiones sin fundamento científico y puede terminar perjudicando a su familia más que protegerlas. Y es lo que se ha estado hablando hoy, esta mañana, ¿verdad? Hemos estado diciendo que puede causar diferentes ramificaciones en el futuro con la familia. Yo vengo a hablar no tanto con profesional, porque esos son mis colegas los que están, pero yo vengo a hablar con el corazón de la comunidad. Yo trabajo con la comunidad y con gente del pueblo todos los días, y por lo tanto siempre hemos tenido ese vínculo y el vínculo y aparte esa confianza con nuestras organizaciones, que son organizaciones no lucrativas en nuestros suburbios de Cicero y Berwyn y todos los lugares circunvecinos. Entonces también otra de las cosas que queremos decir es que mitos como que la vacuna causa autismo, aunque se ha demostrado repetidamente que no es así, continúan ser frente en nuestra comunidad, ¿verdad? Y esto es también por falta de información, que la gente empiece a ver la información y educarse en contra este tema que es el sarampión y contra las vacunas, que mucha gente piensa que es mal. Otros mitos también que podemos decir es sobre la protección que brinda la vitamina A. Simplemente no son ciertos. La vitamina A científicamente ayuda mucho, pero se tienen que educar y tienen que ver que no es una solución contra el sarampión. El sarampión es una cosa muy grave y es más que una roncha, como dijeron anteriormente. Esto puede causar neumonía, daño cerebral, ceguera, sordera e incluso la muerte. Y es por eso que la enfermedad que estamos diciendo hoy es una de las más contagiosas del planeta. 9 de cada 10 personas cercanas se infectarán si no son vacunadas. Por eso la importancia de hoy estamos aquí de hablar sobre esto. Vacúnense, por favor, se lo decimos que a los niños, a ustedes, no es muy tarde para vacunarse. Vacúnense. Todos queremos y amamos a nuestros hijos y deseamos lo mejor para a ellos. Al considerar esta vacunación, consulte los datos, infórmense, edúquense, investiguen por sí mismos y consulten con su médico. Si no tienen un médico particular que ustedes sepan, por favor, también pueden comunicarse con el Departamento de Salud del Condado de Cook para obtener más ayuda, una cita o más información sobre esta vacuna. Y esto se puede hacer a través del número 312-864-1111. Y por esto les pido de corazón que ayudemos a esta campaña que se está logrando ahora para la vacuna contra el sarampión, porque puede salvar muchas vidas y una de ellas las de sus hijos. Muchas gracias.
I'd like to thank everybody who joined us for the press conference today. Are there any questions?
From ABC7.
Hi.
You guys can hear me, can't you?
Sure enough.
Okay, it's okay, if you don't mind. First question, just a house cleaning question. When does the actual campaign begin?
I'm going to ask Dr. Joshi to answer.
It should be rolling out very shortly. The date is the 18th that it's going to launch.
Also, you mentioned, I'm seeing where you say that you've seen a number of unvaccinated suburban youth, Cook County youth, doubling in the past 2 years. Are you seeing similar numbers in Chicago, Cook County, and why are you seeing those numbers in suburban Cook County? What caused that?
Yeah, so just to clarify, the Cook County Department of Public Health is the state-certified local health department for suburban Cook County, so that is our jurisdiction. And so when we report out on numbers, those are the numbers that's the geographic area that we always reference. In terms of what's driving this, I would say it mirrors what we've been seeing nationwide, which is a long, slow decline in vaccination uptake across the board. I think this is very concerning. There's a number of factors that contribute, including certainly vaccine hesitancy, which has grown over time. And it's something that we hope this campaign will address head on. We also have a number of other efforts and initiatives in play. For example, we routinely put out social media posts refuting common myths related to vaccination that we see arise on social media. So this is a multi-pronged strategy that we have. Thank you.
Are there particular communities that you will be targeting where you're seeing this uptick in unvaccinated folks?
Yeah, so we do definitely try to geo-target, and it's focused on communities where we're seeing lowest rates of vaccination uptake. I don't have a list of individual municipalities at this time, but I'm happy to share them with you offline.
And last question for me, unless something else comes in my brain, which can always happen. Can you talk a little bit about the concerns you have with you're trying to offset what you perceive to be or what you know will be an issue with unvaccinated? How much does what some might perceive as the lack of support from a federal level? Because some folks would say a lot of the misinformation or a lot of this information that is causing confusion or concern for parents is coming from the federal level. How do you offset that? How do you?
So I'm a history teacher. This is a very difficult moment in our country's history. And we have a leader in Washington, in Secretary Kennedy, who's made it a point to disparage vaccines and their efficacy. And that is counterproductive and dangerous to the public health of the nation. And we're doing our best to provide science-based information to the people in Cook County and this region, and that's the purpose of both this conference and the campaign. Anything else?
Sometimes.
I'll come here because my voice isn't as loud. You mentioned the data around the growing number of kids in suburban Cook County who aren't vaccinated. What would you tell parents who their kids are vaccinated, but they're worried that they're going to be going into classrooms with children who aren't vaccinated. What kinds of things will the county be doing in terms of possible outbreaks that may happen in the fall or in the winter? And then my second question was, are there going to be any mobile vaccination clinics that you guys will be doing out in the community?
All right, Dr. Joshi, what do we say to parents who have vaccinated their children, and are we doing mobile clinics?
Yeah, absolutely. So I want to reiterate that we're fortunate in having leadership at all levels of Cook County government, as you can see, that is incredibly supportive of vaccination. And I think it should then come as no surprise that we've got pretty good coverage in suburban Cook County. So I would want to ensure that those parents feel reassured, and also be reassured by the fact that we are doing our utmost to ensure that people get the information that they need. And to the second part of your question, that we're addressing any access issues. So we're very aware where there are lower rates of vaccination coverage, and we look closely at that data to drive in turn where we can do mobile activities in collaboration with schools across suburban Cook County. So it's a very focused approach. I think we also engage on an annual basis. It's not just about childhood vaccinations, but more broadly looking at seniors going into respiratory virus season, and annually offer off-hours clinics in partnership with our colleagues at Cook County Health in the 5 ambulatory clinics in suburban Cook County. Thanks.
Sure.
I think one of the great privileges of working for an institution like Cook County Health and at the Cook County Department of Public Health is that we provide care and services to everyone, regardless of ability to pay.
And we've done that for 180 years. We're very proud of it. Yes? So folks shouldn't be concerned about paying for vaccines?
Correct. Yes, that's correct. Yeah. I just wanted to reiterate, because I think there was a question earlier about vaccination coverage, and wanted to reiterate that the MMR vaccine provides lifelong protection from measles if 2 doses are given. Thanks.
Just one more question. Okay. Regarding, as we're heading to the flu season, can you talk to parents, if they have a child that's 1 or 4, is it recommended to do the measles, the flu, possible COVID vaccine, all at once? Can you talk about the safety of that?
Sure. So the vaccine schedule that pediatricians and family doctors follow has been developed over the course of many, many years, looking at multiple studies to ensure that it is always safe to give a number of vaccines at the same time. Where there are any issues or concerns about particular safety problems that an individual child may have, that's really a conversation between that parent and that individual healthcare provider. Thank you. Sure. So without getting into too much detail, the regular vaccine schedule is the one that is recommended. We do not recommend delaying vaccination. Again, this has been studied very carefully. Obviously, we want a kid to be protected as soon as possible. That said, if there are delays, there are catch-up schedules that are prescribed. Thank you.
Are there any further questions?